At Aether, we want to enable pharmaceutical companies to go from disease to cure, faster and cheaper than ever before. With the promise to cure our most debilitating diseases, the pharmaceutical industry has risen from one of the largest industries worldwide. Along with it, the manufacturing cost to produce these pharmaceuticals has only skyrocketed, totaling over $270 billion in 2016. It is estimated to surpass $300 billion by the early 2020s. Currently, the pharmaceutical industry relies on traditional organic synthesis to produce these pharmaceuticals. However, these methods often struggle with low yields, expensive reagents, and even the unintended production of toxic, difficult-to-filter byproducts, all of which drive up manufacturing costs. Additionally, the difficulty in designing the organic synthesis steps, combined with the lengthy reactions themselves, only prolongs the development time of a pharmaceutical. And this prolonged time to market can cost tens of millions of dollars each day in lost revenue. Now what if I told you there are molecules which would take organic chemists months and millions of dollars to produce that can be synthesized by bacteria, potentially on the bottom of your shoe, with efficiencies far beyond what traditional synthesis can offer? And what if recent advances in genetic engineering, robotic automation, and machine learning can allow us to tap into biology's potential in a way never before possible, fundamentally disrupt pharmaceutical synthesis, and drastically reduce the cost of producing drugs?
At Aether, we are building organism design software that will allow us to redesign microorganisms to synthesize pharmaceuticals. In combination with our software, we will partner with robotic laboratories across the Bay Area that will run our experiments with assembly line economics 24/7 and in multiple iterations until we've built a microorganism capable of synthesizing the desired pharmaceutical, thereby replacing organic synthesis with biosynthesis. Now, at the core of biosynthesis is the concept of the pathway, the construction path leading from sugar to a desired compound. An example of pathway we're all familiar with is alcoholic fermentation, pathway leading from sugar to ethanol. Now, while this pathway was discovered by accident, recent advances in genetic engineering now allow us to design totally novel pathways never before seen in nature. And it should be noted, this pathway is actually relatively simple. Most pathways look like this. And by using human researchers to manually search for these vast pathway maps, traditional pathway design takes a very human-centric approach to this problem. We do it differently. Our software designs every possible biosynthesis pathway leading to a desired compound, sends those designs to fully automated, robotically controlled laboratories, which build our designs and run thousands of experiments in parallel to test them. Once these laboratories have completed their experiments, they send the results back to our software, which learns from the data and proposes the next round of experiments. By repeating this design, build, test, learn cycle over multiple iterations 24/7, our technology will radically hone in on a microorganism capable of synthesizing the desired pharmaceutical at dramatically reduced cost and without the production of toxic, difficult-to-filter byproducts. So, why now? 3 technological revolutions have led to this moment. 10 years ago, DNA sequencing costs started to drop. We could now read the code of life. 5 years ago, DNA synthesis costs started to plummet. We could now write the code of life. In the last year, with the availability of robotic laboratories skyrocketing, we can now build the code of life.
Aether's competition comprises multiple companies operating in pharmaceutical biocatalysis, most notably a company known as Codexis. What unites all of these companies, however, is that the products they provide are enzymes, which are proteins made to catalyze single reactions. Therefore, the core differentiating factor between our technology and that of our competitors is that these companies provide enzymes which catalyze a single step within an entire organic synthesis pathway, while Aether provides microorganisms that catalyze the entire synthesis process, from sugar to pharmaceutical. Therefore, Codexis improves one step of the pathway that still suffers from all the original downfalls of organic synthesis, such as the low yields, the expensive reagents, and the toxic byproducts. So by engineering microorganisms that catalyze the entire synthesis process, Aether can lower costs far beyond what Codexis or any other enzyme provider can offer. Aether will generate revenue on a contract basis. For each pharmaceutical, we engineer a microorganism to synthesize. Our contracts will be priced at a fixed percentage of the savings our technology provides over a 5-year period, as per industry standard in pharmaceutical biocatalysis. Aether's products are our engineered microorganisms and all patents protecting their designs. The pharmaceutical company will work with contract manufacturing organizations to culture our microorganisms and produce the pharmaceutical. As is typical with biologically derived pharmaceuticals such as vaccines and antibodies. Therefore, Aether is not responsible for the production, filtration, or purification of the pharmaceutical, and are thereby free from any of the red tape often attributed to the pharmaceutical industry. Aether's first customer segment are brand name pharmaceutical companies, which engage in preclinical and clinical testing to bring novel, patent-protected pharmaceuticals to market. Within brand name pharmaceuticals, our market is further divided between preclinical pharmaceuticals, which after successful preclinical testing need to be scaled up in manufacturing for clinical trials, and newly approved pharmaceuticals, which after successful clinical trials and FDA approval need to be mass manufactured for introduction into market. Our third customer segment are generic pharmaceutical companies, which provide generic versions of drugs after their patent has expired. For generics companies, our business model applies to any of the pharmaceuticals they are manufacturing and distributing. Aether's market is divided as per our market segmentation. We have calculated the application of biocatalysis to newly approved pharmaceuticals to constitute a $765 million market, preclinical pharmaceuticals a $2.25 billion market, and generic pharmaceuticals, the largest of all, at $7.11 billion. Details regarding our market calculations can be found in our executive summaries, and we hope our continued conversations with industry professionals will allow us to continually update and refine those figures.
Aether's founding team is Pavle Jeremic, a double major in bioengineering and astrophysics with over 6 years of wet lab experience, as well as a publication in the Astrophysics Journal. Chase Armour, a bioengineering major with bioinformatics minor, brings extensive research in team operations and market research, most notably performing the role of head of operations for the 140 graduate and undergraduate Formula Select team building a fully electric Formula 1 racing. And finally, myself, Hannah Myers, pursuing a combined BS/MS in bioengineering and bioinformatics, bringing experience in multiple labs across campus in both computational and experimental studies. Our scientific advisor is Dr. David Burnham, previous program director at Hewlett-Packard and lead author on 7 patents. Our business and technology development advisor is Robbie Jane, former president and CEO of a software development and bioinformatics consulting firm. Aether is currently in negotiations for a seed investment with Amgen, a global biopharmaceutical company. We intend for this seed investment to set the foundation for our first contract with Amgen, following which we will expand our customer base to include other pharmaceutical companies. We are therefore seeking a small amount of financing in order to test our technology and process design, which will allow us to generate useful data to validate our software. The total cost of our test will be around $60,000. DNA synthesis comprises the majority of this cost, with the rest split between robotic laboratories and chemical analysis, and a small amount left over for server fees. To give a visual representation of our process, Aether will generate a list of the genetic designs. Twist Bioscience will synthesize this DNA. Robotic laboratories such as Transcriptic and Emerald Cloud Bio will run our experiments, and finally the Joint Bioenergy Institute will perform chemical analysis. So far, to raise money, Aether has been participating in business competitions around the Bay Area, as well as 2 accelerators. So far, we have won 3 $500 prizes at pitch competitions at UCSC, $4,000 with a first place win at the Business Design Showcase hosted by the Center for Innovation and Entrepreneurial Development. We have also been accepted into the Citrus Foundry, the premier UC accelerator, which provides us an invaluable wealth of resources in their program and mentorship network. We've also been accepted into the new Santa Cruz Works Accelerator. However, we'd like to make a correction on this slide. We had previously stated that we would be receiving $30,000 from them. This was based off the convertible note we received, which specified $30,000 and made no mention of in-kind services. However, it has recently come to our attention that this is in fact $10,000 cash and $20,000 in kind. Please keep this in mind when examining our progress so far. So, we've been fortunate in raising this money so far, and an additional $20,000 will be another crucial piece to our validation. At Aether, we want to combine the latest in machine learning, genetic engineering, and robotic automation to breathe new life in pharmaceutical synthesis. Thank you.
Pricing strategy. It was a great presentation by the way. Absolutely fantastic. How do you price? What's your
So
strategy?
right now, we're exploring options with the industry. Our hope is, and what has been done in bioanalysis before, is that there is a contract with a set fee. So basically, initial upfront payment, payment upon completion, and then if this molecule is used or this technology is used, this microbe is used later, we get a percentage of either revenue saved or just of revenue in general based on projections. And right now, we're really excited to be using a program called the NSF I-Corps program, which gives us a $50,000 travel grant to speak to executives across the planet in the pharmaceutical industry. And so we are currently exploring what that exact price would look like. The best option right now, it seems, is the contract, and then we're exploring, percentage of revenue, percentage of cost.
Second question, scale.
Yeah.
So you got 3 of these contracts, you get a nice warrant type package looking forward, a couple of IPOs out there instead of basic company. How do you get really big doing this?
This scales extremely well. All of this technology, computationally, we've designed it so it's not computationally intensive. We leverage existing robotic laboratories. That's one thing we need to emphasize, is that this technology, the robotic component, the actual experimentation, not our software, already exists. And we can leverage that technology and those laboratories to scale very quickly. And with the value of these contracts set at, for example, Codexis gets $15 million per contract, we can build our own laboratories eventually if need be, if that no longer scales appropriately.
Are you like another Google? Every time you do one of these things, you get better and farther.
Yes,
into your
that's
company?
another thing. With this data, that's a huge component. This data, we get to keep the data in the situation. Our algorithms get faster and better at doing this very quickly.
The data, I'm glad you brought that up. It will very likely be the most valuable asset that we have.
Yes.
It'll end up being especially competitive advantage.
Yeah.
So, in terms of your intellectual property, your sustainable differentiation, how do you protect this? Because everyone's going to follow you in if you're successful.
Yeah. Two major things. Our intellectual property, the proprietary information we have, it's on the software side, it's algorithms that we're testing and that we're developing. And in terms of protection in the long term,
Software is really hard to protect. Right?
No, that's true, and our advice from mentors and from legal counsel has been that we don't patent anything, we keep it all trade secret, absolutely secret. And then the advantage is that we generate a huge amount of data with this, even the basic experimental runs. So this stuff moves very, very, very quickly, and in partnership with Amgen, in relationship with Amgen, GlaxoSmithKline, Roche, and stuff like that, we want to be able to get that sort of head start to be able to keep moving forward. So if that answers your question.
So what's developed now?
Right now, we have initial software. We have metabolic modeling software. We put that together. What we're looking forward to right now, and what Hannah mentioned, is the process validation. Because one thing that's really important, right? We are arguing that we can just sort of use these laboratories that already exist, and we've done a lot of experimental design to make sure that we have controls in case anything goes wrong. So this 60,000 that we mentioned is to confirm that, hey, this is an experiment, our software output says do this. We want to make sure that we can actually run it through the pipeline, that we know where the problems are, and so we know exactly how it's going to work and how quickly it's going to respond. So that's kind of the developmental stage that we're prioritizing.
Who's writing the software?
All three.
So the 3 of you are the total company.
Yes.
You're developing the software. Do you have any experience in machine learning?
From research. Most of machine learning on mine. So the breakdown in terms of the software and the algorithm is I work a lot with heavy computational machine learning. Chase works a lot with chemical modeling, and Hannah works a lot in bioinformatics. And so that's kind of the breakdown. So in terms of trying to get the learning loops working, that's me. Chase works on the chemical identification and looking if the pathway is feasible or not. And Hannah works on modeling that within the context of an organism.
And so then the output of your software is a set of instructions to the laboratory to create the molecule.
Yes, it creates, so the software outputs a sequence of DNA. It says, these 3 enzymes, I think, will probably do it. That sequence of DNA goes to twist inside the DNA. DNA goes to an external laboratory. They put it inside a bacteria or yeast. And then that laboratory grows up that yeast and sends it to J-Bay in Berkeley, which will run analysis to see, was the chemical that we thought was going to be produced, how much of it, how much compared to what we thought, and what else was produced as well. And then that's where the learning loop, at least the initial learning loop, goes in.
Why wouldn't you put all of those units together and have sort of a
In-house
feedback?
So you mean like in-house
Yes.
one? The major reason is that it's to scale faster. We, right now, the delay in terms of, because everything's in the Bay Area, we literally can drive these samples.
It should be probably more, if needed.
Yeah, and in terms of building it ourselves, while it's not insanely expensive, there's a lot more difficulty there, and these services exist and they're fast and they know what they're doing.
Yeah, that's what we're really excited about, is that these robotic laboratories exist. And if we can actually leverage the growth that they're going to experience to scale much faster than us trying to build it ourselves, bringing on roboticists, so that's what one of the big things we think is
Yeah.
really exciting opportunity.
And then eventually, at a certain point, you will run out of existing robotic laboratories and you will have so many experiments they can't handle anymore. And then once, as we understand the market, as we understand other services, there will be a point where we want to insource and put it all together to make it as fast as possible. We are not at that stage yet, and we believe we can sustainably grow quickly with this model.
Amgen permitted?
So Amgen right now, there's 3 conversations we're having with Amgen. There's the seed funding conversation. We have found when we met with them initially, there's an enormous need for this. They spend a lot on organic synthesis, and they want us to try and solve that problem. We're talking about getting a grant from them to develop this technology. So instead of necessarily equity diluting seed, we might just get a straight grant from their chemistry and process development group. And then the thing we're most excited about is the contract. So the goal right now of the Amgen conversation is this summer up to fall, we're going to be working with them to do the validation, show iterative improvement, they can either grant or seed funding, and then they want to turn over to contracts very quickly.
The large focus of ours is making sure there's no exclusivity. If we're going to see an investment with them, our interest is not that we can exclusively work with them. So that's something and that's why it's good that we have 3 different options. Yeah.
Excellent, thank you very much.